Hey guys, I'm joined here with Reagan from ALTUS, who's going to be joining us here on the Brooks Report Live. My name is Adam Brooks. Hey, we have something special coming up for you guys. It's called Doc Talk. It's going to be happening here on the Brooks Report Live occasionally. Reagan, tell us what we have coming up.
Adam, thanks for having us, guys. We're so excited. Like Adam said, be sure you like, subscribe, and share so you guys can stay informed and up to date. We're going to be doing all kinds of good, relevant topics that you guys in the community are asking about. And the great thing about this, Adam, is it's a live Q&A with a real doctor. You guys can hop on live time, ask your question to a real doctor. We're going to be talking about important topics like, COVID, what's going on in the current health system right now in the world. So many things that you guys want to know that you're asking about. We're going to talk about it right here, So thank you, Adam.
Yes, sir. Hey, listen, I want to say this is just another one of those things that ALTUS does for our community to bring us. And so we thank you guys. Listen, put a 1 in the comments if you're watching this live. Go ahead and do that now, and put a 2 if you're watching the recorded version. And don't forget to share this stream. Tag some folks that maybe had some questions you've seen posted on some groups, and, well, they can ask a real doc right here. So thank you, Reagan, for doing this on the Brooks Report Live. We appreciate it. Thank you, guys. Now enjoy.
Hey, Adam, thanks. We love you guys. We love our community. And this is just one more way ALTUS can give back to you guys. Here we go, guys. Enjoy the show. Dr. Goffi, what's up, man?
Good afternoon, everybody. Well, glad to be
Facebook.
back.
Hey, glad you guys are joining. I think you just got back from an awesome vacation, much needed vacation, huh?
Yes, my wife and I were able to spend a couple days away. It was kind of nice.
I think you got a tan, so you must have got some sun. Huh?
We did.
Awesome. Well, guys, thanks for joining our session of Doc Talk today. Today, we want to talk about COVID, but not only COVID, we want to talk to you guys about the current healthcare situation, what's going on right now in the medical community in general. So, Doc, I've already got somebody asking a question today. They said they got their second vaccine, but a few days later, they're still having low-grade fever, like 99. Is that the body's normal response?
I'll be honest. I felt terrible after my second shot. I got a migraine, which I suffer from occasionally. And what that is your body responding to it. And you got to remember, like I said, if you react that way to the vaccine, that means that you would have reacted significantly worse to the virus. These are just small micro doses of the virus in order for you to make antibodies. So a little headache or a little arm pain or a little fatigue or a little fever, that's preventing you from having serious complications of actually getting the COVID virus. And it may not feel great for a day or two, but that's better than spending 2 weeks or possibly passing away from this virus.
Right. So a little bit of low-grade fever after the second vaccine is fine for a few days. That's just normal body. Okay.
Some people might get it actually from the first one. Don't be discouraged, because that means that you maybe got the silent COVID, a year ago that was, much milder than what we're dealing with now.
Right.
That's a very good question, by the way. It's important because some people can be deterred from getting the second one. If they get the first one, they get some mild symptoms, but it's okay. That's the body. That means that you're reacting, and you're more than likely to develop a very good immune response and viral protection, basically, when the future, if you were to contract it. But remember, it's not a cure. You're just getting help to prevent serious disease.
Right. So another person just asked, is RSV still a thing right now? Have you been seeing any RSV cases?
Yes, we are. We are. RSV came with a little bit of a vengeance this year. It was a little bit silent for a little while. The kids, were not really in school spreading it as much. So therefore, RSV did come out a little bit. We have a little bit of different plants associated after the freeze that are coming from different states. So people's allergies were a little bit worse. That made you a little bit more susceptible to the RSV. And even in adults, some people are testing negative for COVID, but actually having a little bit more serious RSV this turnaround. Yes. Right.
And to follow up on that question, somebody said they've heard that if you have O positive blood, sometimes you're more resistant to RSV. Is that true, or is that just
So there was some talk with O negative blood. I actually am O negative, the universal donor, and I got COVID the first time, and I did not pop positive for the antibodies. However, that was really early in COVID, and I don't think that those tests that they were doing were as accurate as they are now with the antibodies. But there was some talk about it, but nothing's been proven. Nothing's been proven.
Nothing solid. So, Donine, how you doing? Thanks for stopping by. She said, what sign should we look for? I guess she's talking about COVID and kids, and what time frame does that show up?
It's not any different. Kids are usually more silent than us. So if they're going to have symptoms, it's the same as the adults. I can't stress enough. One of the biggest things that we're doing is we're waiting to get sick to be tested for COVID.
Mm-hmm.
You know, if you're not vaccinated and you were around somebody, let's say Friday, Saturday, Sunday, don't wait till Friday when you feel very bad to come in for treatment. The treatments that exist besides the vaccine are more effective the earlier you are positive and asymptomatic, rather than waiting until you feel bad. Because the worse you feel, that means the virus has been spreading for longer. So it takes more body work in order to get rid of it.
Right, right. And another person just asked, are children super spreaders? Do you think that they spread more than adults, or is that just not proven yet?
When you have a vast majority of people like that are just not routinely getting tested or feeling the symptoms, it's hard to determine that. Regardless of what people are saying, let's use common sense. I believe in common sense. We're never going to know the true, if that's true or not, okay? Just like mask wearing for children. I think that's an important topic, right? You know, it's that all or nothing. It's like my school's going to close or we're going to wear masks. I hate that topic, unfortunately, because we could use some common sense. But my sister is a teacher, and one of the things she mentions too is, are they super spreaders? Well, if they wear a mask or not, you also have to remember that kids are not adults. These kids are sharing masks. These kids are swapping masks. These kids are using the same mask for 5 weeks. So the effectiveness of masks for kids goes beyond just saying, is it effective, right?
Right.
If it was a perfect world and they can go in and out and get a new mask, some kids are finding a mask on the floor because they need one to, get into the school. So it's not necessarily great for someone who's, in individuals like that they can actually spread it unintentionally by getting a mask because they're finding a random mask somewhere.
Right.
And my kid's even guilty of that, and I have masks everywhere. Where'd you get that mask from? I like my friends better. And I'm like,
oh gosh. Now what do you might be getting something totally different than COVID too.
Right. Now you're getting RSV instead of COVID, so can they be spreaders? Of course they can. Anybody can carry it. They can get the virus. They just are asymptomatic and their immune systems are so strong. But that's what to remember, right? So to bring that into, like, let's say you're vaccinated and you get COVID. You're not going to be positive for 7 to 10 or 14 days like a regular individual that's unvaccinated, because being positive for COVID just means that you don't have enough antibodies to attack the virus, and therefore you're shedding the virus, right? So if you're vaccinated, you may only be positive for a day, right? Because your body overcame it. Same as kids, their immune systems are so good that, maybe they are positive, but they shed the virus for 24 hours. So simple routine hand washing, maintaining social distances, especially if you're around people that you don't know their vaccination status, all of those are positive things.
So Doc, let's take a step back just for a second. Since we talked last time, how are things looking? Do you think things are looking worse? Are we getting better? Are things about to plateau for a while? Or is it still just as bad, you think, as last time?
I think it's worse than before. Unfortunately, we have to remember, we spoke about 2 weeks ago, and a lot of those people that were in the hospital that day continue to be in the hospital today.
Yeah.
And what that means is that all of those people that were infected in the past 2 weeks that continue to need care are either waiting in places that are not ICU, where they need an ICU, right? Like certain emergency rooms or emergency room beds, and they're still not able to get up to that higher level of care. So even though the numbers continue to be close to 100% occupancy, unfortunately, the 100% occupancy is not real. And we're at 120, 130%. As many of those people who are real sick have not left the hospital since we last spoke.
Right. So I have somebody asking, is it there's the beds the issue, or the staffing, like not enough nurses? What's the main issue? What's the bottleneck here?
Well, the bottleneck is both. Like I said, it's not normal to be in the hospital for 2 weeks ever. And we are officially in a medical emergency that we've never seen before, right? I mean, we've seen it for the past 18 months, and we started to do a little bit better at it because the vaccines came out and saved millions of lives that way. But it's worse than what it is now. I don't see necessarily an end in sight if we continue, especially with the unvaccinated population. I think it's continued to get worse because the virus is going to get better, like it did with the Delta variant. We probably will face another one for those individuals. Right. And you have to remember that just like if your job, if you're vaccinated, sends you to go get a COVID test and you have sniffles and you're positive, you're not necessarily ending up in the ICU. You're not necessarily ending up in the hospital. That nurse can't come to work for me. So we're losing nurses. And the problem is that that's a nationwide issue. So sometimes you can't open a floor, right? Or you have to move patients to another place, and you have 20 or 30 beds, let's say, in a big major facility, right? But you don't have staffing for it. So it's a combination of both, because they're directly associated. If I can't open the wing, it doesn't matter if it's there, right? And that's a major issue. So it's across the board the same issue. Luckily, the nurses that are vaccinated are able to come back sooner. They test negative sooner, and they're not being hospitalized. But it's the same problem, and it's only getting worse.
Yeah, since you left, talking about getting worse, Lumberton and a lot of other local schools have shut down for a week. I'm not sure if that's enough time. I'm sure a lot of kids or people might have been going home and just now getting it. So I mean, it may still, be pretty rough when they're coming back with a lot of cases. So I do think things are getting worse for sure, at least right now. So like you were talking, the schools are not enforcing masks; they're just suggesting it. So hopefully when they get back, things will be, I'm hoping that if some people will wear masks, that'll help them. But like you say, it worries me because, some of the kids do not wear them properly. So that's another thing that worries me.
Yeah. And remember, we're not vaccinating 5 to 11, a lot of people are hesitant to the 12 to 18. But the issue that's why schools are closing, it's not the kids, it's the teachers popping positive, and then family members popping positive.
Right. If there's no teachers, they can't go on to teach.
Right. So if teachers were vaccinated and so were the parents, we probably wouldn't need the school closure for the week.
Right. Right. So aside from all of this, Doc, how are you feeling? How are your colleagues feeling right now? Are you burnt out? Are you worn out? What are you guys thinking right now?
We're definitely not worn out. We care about the community, and this has been probably the toughest part of my career I may ever face. It's definitely the hardest one I've faced so far, and probably going to be the hardest one I ever do face. But we're proud to come to work. I mean, this is why I went to med school. This is why nurses went to nursing school. It is very difficult on us because we have patients that are there for a long time, and we have patients that are very sick. And we know that the likelihood, unfortunately, of passing away, especially if you need to be on a respirator or you need to be on those, and we're with the family the whole time, right? I mean, we're talking to the families every day. They're not able to come and see their family. It does take a big toll on us, but this is also why we're in this profession. It's something that I'm very proud to be able to speak to the families, which is why I always tell the families to make sure they call us. They do not bother us when they call. If anything, we like to give the updates. It's just unfortunate that it's tragic events usually associated with people spending a lot of time in the hospital.
So another person has asked, they said, you see, there's a lot of routine medical care practices right now from their PCP are changing to teledoc. So they're not going in person. They're doing a lot more teledoc visits right now. You think that's because of the current situation we're dealing with?
Yeah, they're worried about other patients. Some patients that come to a family physician, they could be cancer patients. They could be a variety of patients that naturally, or they can't get the vaccine for very, very few reasons. Let's say they're allergic to something, which there's not many reasons for it, but sometimes they're just immunosuppressed and they are avoiding it if they can. But it is causing other issues, right? I know we talk about COVID a lot, but unfortunately, cardiologists are doing the same thing. So people are not getting the stress test. People are not getting the ultrasounds of their heart. People are not getting all these other cares, or they're not getting refills because they can't get appointments. I can't stress enough. You have to continue your normal routine care. You might be scared of COVID, but diabetes is, could be just as bad if it goes untreated for 6 months.
Blood pressure, diabetes. Yeah.
because you're scared about going to your primary care physician. You have to maintain your routine care. You have to maintain your normal medications, regardless of COVID in the world. There's other medical issues that are happening.
Yeah, there's a trickle effect right now. I mean, people, like you say, it's affecting everything because it's gridlock, and I guess people are scared to go get their normal routine stuff.
And if it's a teledoc way to get it, then it's a teledoc way to get it. People, I mean, you have to make sure you maintain and get your regular medications.
One way or another.
You don't want to go 6 months without blood pressure meds.
Right. Brittany just asked, how do you know if you had antibodies for COVID? I think you've talked about a little bit about this last time on our last video.
There is a lab that you can get. There's IgM, which is immediate antibodies, meaning you're currently undergoing the infection within 2 weeks, and IgG, that is what's considered long-term immunity. That test is usually done simultaneously. You always check for both. It's a blood test, and it's recommended. You can call your primary care to give you that order. We don't do that in the emergency room setting. That's an outpatient thing. But one of the good reasons to use teledoc, get yourself in order and see. I mean, a lot of people could be immune because they went through a silent case, but you won't know without those antibodies.
Right. And before I ask this next question, I think while you were gone, I don't know if you know, Beaumont just opened up an infusion center. Did you hear about that?
Yes.
They've been doing, hundreds a day. So this person has a question. So how effective is the antibody infusion for COVID?
Amy, great question. So this is what I was saying. If you're hanging out with somebody on Friday and Saturday, okay, you had a barbecue at the house, and it comes back on Monday morning that such and such was positive. It takes 2 to 3 days for you that you should be able to pop positive for COVID. If you pop positive for COVID, you were proactive and you didn't have any symptoms, and you went and you got this infusion, the success rate of avoiding the hospital is very high. Okay. The longer you wait and the more symptoms you have, that means that you let that virus replicate over and over and over and over again. And those stop them. I mean, not completely, but it gives you basically mercenaries to go and fight this virus initially to prevent the spread of it becoming worse and replicating. So it's imperative. I think it's very important for you to get it. I believe you should get the vaccine first, but if it's too late, then that's the best treatment that's available right now in the country.
So another person just asked, speaking on infusions, what are the main requirements that you think they need if you're going to give a patient the infusion?
So you need to be positive for COVID. And that's why I say the earlier you get tested, the better, even if it means, I know it's miserable to get tested. But if they were Friday, I would highly recommend Monday and Tuesday going to get tested. If you're negative Monday, get retested Tuesday. If you're negative on both those days, go get vaccinated immediately. That's what I recommend. That's what I recommend for all my friends that are not vaccinated, even though I tell them daily, I send them daily reminders to go get vaccinated. But if they're around anybody, I make sure that they get that Regeneron treatment. Absolutely.
Awesome. Awesome. Let's see. I'm trying to go through some of these questions here. Let's see. So if you are 7 months pregnant, is it safe to get a vaccine? I don't know. I think you mentioned a little bit about this one as well on our last topic, being pregnant.
It is safe. It is safe during pregnancy. Naturally, we want to try to get it earlier. But all of the OB-GYN specialists are saying that it's safe during pregnancy. Unfortunately, we are seeing complications of COVID, not from the vaccine, but from COVID specifically. It is affecting the baby while still pregnant, because sometimes mothers are diabetics or they have complications, with blood pressure. So I definitely recommend talking to your OB-GYN and seeing what they recommend for you. It's very, just being 7 months pregnant doesn't fit 100% of people. There may be another reason why they don't recommend it for you if you have certain history, but for the most part, it is recommended by the board of OB-GYN. Yes.
Gotcha. And somebody was talking about the schools, because we were talking about schools earlier. They want to know, do you think it helps at all to take a break, like a week off like they're doing? Do you think this will help slow it at all, in your professional opinion?
Only if it takes time for the parents to be able to take their kids to get vaccinated themselves. Kids, it's It's not approved for 5 to 11. It is 12 to 18. We talked about that before. My kid had COVID. I'm waiting a little bit more for my 13-year-old, but I think at 18 and above, it's safe. I would highly recommend it. Those are usually not the schools we're talking about right now. But yeah, I would recommend. I don't think it's going to do much, the 1 week off. No, I don't.
Right.
I think it'll do worse for kids, in my personal opinion. I think kids need the social environment. I think kids, going digital is not necessarily positive in the long run. I think that could lead to some depression, and I hope parents are proactive with that, making sure that they talk to their kids and keep them social.
Right. Angie just said, should you get the infusion if you were sick with COVID or wait till you get really sick, bad sick?
The sooner the better. That's what I was saying.
Right.
The sooner you're positive, go for it.
I think they said the first 10 days is the best onset, right? Right off the.
Well, that's part of the requirements. It has to be within 10 days and you have to have a positive test. So that's why if you're around somebody on Friday, Monday and Tuesday, go get it.
All right. Sean said, my husband is in stage 3 of kidney failure. Let's see, has this disease possibly I'm not going to try to say that one. She might possibly have a tumor. Is the vaccine safe?
So they recommend people with autoimmune or problems with autoimmune to get vaccinated, and are also the reason to do. They're the first ones to be in line now for the basically booster shot. It would make no difference on the kidney failure. The Hashimoto's comes and goes. So during an acute flare, I will have to say I'm not 100% sure during an acute Hashimoto's flare, but most of the people you would be considered immunocompromised, and they definitely recommend for you to get vaccinated. I'm sorry I can't answer that question perfectly for you, but Hashimoto's is not always active, right? So I would check with them.
So Obi wants to know, how do you think the landscape will be once winter is here? Typically, our immune systems usually drop with the cold weather, lower vitamin D. What's your thoughts on that, Doc, and the flu maybe?
Unfortunately, when the winter comes, all of these cases, the risk of death is going to increase probably 1,000-fold, because the cold is not very conducive to our lungs. So that's why patients who are smokers, they don't feel as well in the winter months. Plus, you have the flu on top of it. And if you're around somebody who can get flu, you could be around somebody and get double infected, which was happening with that early cause in COVID, where people were having flu and COVID. I can't stress enough that if you're ever on the fence, now's the time to get vaccinated, because if you get this disease during the winter where we do not breathe as well, it's going to be even deadlier. That's why I don't see a plateau coming. The summer months is something that you don't normally have people complaining about stuff, in the chest. But if you add those two components, I think the risk of death is going to go up probably 1,000-fold.
So if you guys are watching that, you heard him. Things are trending up. Things are not looking better at the moment. And like he said, winter's coming. This is the time, guys, right now. If you haven't, get the vaccine. Things are going to get worse. Right now is the perfect time to go get your vaccine. Let's see here.
I will tell you, there's a couple people that were vaccinated, and I think this is an important story. We've had a few people that got their first dose of Moderna, very high-risk individuals, and it was because their daughter or somebody around them that they were not next to, right, got COVID, didn't feel very well, and they got the first vaccine. They got infected before the second shot, and all of them avoided hospitalization. All of the people that we're seeing ending up on vents, they were 55 and above, whether they were overweight or they were diabetic or they had high blood pressure, all of them have made it out of the emergency room and not needed to be admitted to the hospital or ICU. Just that beginning has changed even those lives. And I can't stress enough the importance of the vaccination.
Yeah, Doc. Hey, I have to agree with you. I have family members that only got the first dose of the Moderna vaccine. Like you said, we had just talked about the Diet Coke symptoms. I really feel like if they didn't have that, they would have ended up, in a bad hospital situation. Yeah. I really think even just that one dose really helped save the.
Yeah. And I mean, you should get both. But right. Just starting the series made it so that they had 2 weeks of making antibodies and allowed them to not have the disease as serious as it would have been.
And since we talked, I think Pfizer is now FDA approved. I think last time they were working on it, but now it's officially approved. So if that's holding you back, it is now FDA approved.
There's no reason to have that. If you're not autoimmune, should you get the booster? I personally believe yes. I think once you reach the 9 to 12 months, you need a booster. I'm not sure if they're allowing it, but as soon as they allow it, absolutely, I would say go for it. We don't know how long the antibodies are going to last. It's a vaccine just like any other, and it's a virus that's unlike any other. This is an mRNA virus. It's different than all the other ones. I hope that one shot would be enough, but if it takes an extra shot to avoid the serious complications and possibly death, I welcome it.
Right. Sean said, I run an outpatient behavioral health program, and I just had 3 patients pass away today. Yeah, it's real, and it's happening everywhere. Unfortunately, it's horrible.
Yeah, if you have a circle of friends, just 10 friends that are 30 and above, I hate to say this out loud, but you will probably lose 1 or 2 of those friends to this disease if they're all unvaccinated. It's getting that bad, people. It's a shame to say it, but it really is getting that bad.
And just when you think things are getting better, Doc, I was watching on the news last night. You were talking about variants earlier. You probably just heard about this. Is it called the Mu or the Wu variant? There's already a new variant they're talking about on the news.
There's a Lambda, the Mu. Different countries obviously are dealing with different ones. The Delta itself here came very quickly. The world is small. I mean, the days of people travel every day from all the way from China to Australia. The world has gotten a lot smaller. We can get a variant here, and every second there's thousands of people landing from all over the world.
So just when you think it's getting better, you hear something about a new mutation, a new variant. It's just unbelievable.
Well, it's because it's spreading so fast, and people are not vaccinated.
So
remember, we can solve this problem. We have enough vaccines for our population.
Right.
The United States shouldn't be having this issue.
So Robin wants to know, can you still get COVID after getting vaccinated? Maybe she just joined, but we were talking earlier about how, you can get a lot less sick from getting the vaccine. If you want to tell her about it.
So exactly, getting the vaccine getting COVID is of course possible, but you have already the immune response that you need. What it does, it's not a cure. What it does is prevents you from the seriousness of the disease. You immediately start fighting it from day one, and you can either go with no symptoms at all or very mild symptoms. Most of the people, like I've said this before, that we diagnose with COVID post-vaccine are usually there because they have sniffles and they have to get tested to go back to work.
Right.
But not because they need any serious serious complications from COVID.
Chris says, Dr. Goffi, you are our rock. Thank you for caring for the people in our community. Thanks for stopping by.
Thank you.
I've also been hearing about this, Doc. Dale wants to know if you can talk about this. How do you say it? I don't want to say it wrong.
Ivermectin?
Yeah. So tell us what that is. What is that?
So ivermectin is not an antibiotic. I know they talk about it for vets and things like that. So certain medications are working for different reasons, okay? Just like azithromycin, or the hydroxychloroquine. They produce a reaction in the body, right, that allow red blood cells and things like that to better carry oxygen, even though they're really to treating other things. And they found that it reduces the symptoms and improve mortality. But it does nothing to kill COVID. It just helps your body mask it, okay? I do not recommend you finding ivermectin at the pet store because it's not the same. The doses are different, and it's not made for the human body. And so be careful with getting it. Make sure it comes from a medical professional. It's not something to take every day because it could be toxic to the liver if you take it every day as preventative. It is only used in acute cases. I do use it. If you were to come to the ER, I do prescribe it for day 1 and then day 3, but it's not something that you can freely just take because it's, people are talking about it on Facebook. Those have serious side effects if taken too much and not the right dose.
So April said, are you still contagious if you are fully vaccinated, but you tested positive?
So the CDC will tell you that you're kind of not. And usually it's because you don't have as much symptoms. You're not usually as you're not coughing and things like that. And that's really where they kind of hold back some information, essentially intimately with a partner, meaning sleeping in the same bed, sharing a cup, rubbing your nose and putting it on something. Could you hypothetically be contagious to somebody? Yes, but the hour for that is people are really only testing positive for like a day. So it's not, you're not as contagious, to tell you the full truth. You know, you're not like somebody else who's unvaccinated that can be spreading the virus for 7 to 10 days.
Right. So Obi said also, can you talk about COVID, how it attacks the inflammation in the body?
So COVID has become so dangerous because it releases inflammation means like cytokines in the medical world. Okay. And what that does is when you have inflammation, it tells your body to do something. So a best example is, you know, a shoulder injury and it hurts. Well, that inflammation says, I ripped something. So the cells go there, right? They clean it up and then they make scar tissue. With COVID, you're releasing so much in so many different places that it can cause you to form different tissue in different areas where it doesn't belong. For instance, the lungs. That's why a lot of people are having lung trants because of COVID. So you're getting all this inflammation in the lung, and it's not all specific to helping the lung. Some of it could be from other places of the body, and you start to make fibrous tissue all throughout the lung tissue. And basically means that you need a lung transplant. And that could be as early as 25 years old or 65 years old. It could cause your bone marrow, like your blood, you know, what makes the blood of your body start to become scarred, and therefore you can become anemic for the rest of your life. COVID is causing so many things that we're studying now real time, and it's causing major problems later. It could also cause you to make more plaques in the heart, make blood clots, and all that is from inflammation. And then that's why COVID is so difficult to treat. You start thinking about just shortness of breath, and all of a sudden you're dealing with blood clots. You're dealing with not making enough blood. You're dealing with scarring of the lungs. You're dealing with strokes because clots can get, you know, can go anywhere in the body. So that's why it's very imperative not only to get the vaccine, but also the early treatment with the medications that we have. Don't wait until you feel bad, because that means all this inflammation is happening, right? And it just makes it harder to recover.
So Arlene said, I didn't hear the answer to Sean's question. Is there any vaccine better than one or the other for autoimmune, or is that just up for discussion per doctor?
I personally had the Moderna. The Pfizer is equivalent. It's the first one that was FDA approved. The Johnson & Johnson, I think, has its place in the world because it's one shot. And during the time that it came out, it was one of the few that was out there. I think the best thing to do, the best numbers are Pfizer and Moderna. But if the only thing you have access to is Johnson & Johnson, get something under your belt.
Yeah, something's better than nothing, in my opinion.
Absolutely, yeah.
So Kat said she's vaccinated and she has COVID and she's coughing. So I guess just because you're vaccinated doesn't mean you're not gonna have, you know, symptoms.
Yeah,
right?
you can have a cough. I mean, you know, I got recently tested because, well, my kid goes to daycare. We work. And, you know, it wasn't COVID, but there's a million other reasons to have cough. And one of the things to be grateful for, Kat, if it is COVID, all you have is a cough.
Okay. Brittany wants to know. Sorry, go ahead.
You know, if all it is a mild symptom of a cough and you have COVID, the vaccine did its job.
Right, exactly. Brittany wants to know, if kids get COVID, can they get it again?
Same as an adult, absolutely. That's no difference. They're going to have an only better immune response to it.
Perfect. All right, let's see here. Let's see. Stephanie says, I'm vaccinated. I have a cough, but I keep testing negative. Is this common?
Well, I mean, there's a lot of reasons to have a cough, but that's what I mean. That you asked me about, are you infectious? That's the whole point. If you're vaccinated, you stop the infection so early that you may have a symptom for a day or two or three, but it's not replicating anymore, right? So it is an upper respiratory virus. You might have a cough for a little bit, but you're not shedding the virus and it's not replicating anymore.
Okay.
If it is COVID.
Here's a good question, Doc. April wants to know, does the vaccine destroy your natural antibodies, or does it, you know, make you even, you know, stronger?
Does you mean if you if you had the virus first and then got the vaccine, No, it does not destroy your natural antibodies.
I would think it would only bolster you up and make you, you know.
Exactly. Yeah, exactly. And that's why if you went silent and got it, you may feel symptoms off the first one because your body is already ready to fight it. Versus the second vaccine dose, usually, because you have it, can make you have some discomfort, arm pain, maybe even a mild fever.
Right. Kat just said, I could not get meds because the urgent care told me they were not treating just because someone tested positive. She went and got the infusion. Okay.
Good job. I'm very happy that you got the infusion. We do the infusion at ALTUS Lumberton. I hear now that Beaumont's got an infusion center. The fastest place to get it, or wherever you can get it, you test positive, get that infusion.
That's awesome. Doc, hey, thank you so much for chatting with us today, talking to us about what's going on currently. And it seems like we can't get away from this COVID. It's just everywhere. The system is buckling down right now everywhere. I know the wait times are thrown out the window right now. Probably any place you go, there's going to be a little bit of wait. That's to be expected. Just so much going on.
And please don't forget that we're there for you at Altus, but wherever it is that you need, do not negate your family's health for other reasons. If your kid falls, hits their head, or don't wait to get an X-ray or any of those things. If it was an ER visit a year ago, it should be an ER visit today. We're there for you. We're there for the community. I'm very happy to answer any questions. You guys can send anything to us. I'd be happy to ask them. If you have a topic you want us to talk about, happy to do that. But every week we can come up with a new one. If the community feels like they want some more insight, something just besides COVID, that's what we're here for you. Nothing better than answering the questions of the community to stay up to date with everybody.
Hey, real quick, Doc, this is a good one you need to answer before you leave. Should you get vaccinated if you've already have COVID?
Absolutely. It's recommended. It was 90 days, then dropped to 60 days. I would guess it's going to be 30 days soon post. Or they may keep it at 45 or 60, but you should absolutely get vaccinated, even if you've had COVID.
Right. Hey, Doc.
They don't recommend to do it while you're infected, but that's why, 45, 60 days out.
Hey, man, we're praying for you. Obi said he's praying for you. We're praying for you and your whole staff. We're praying for our community. Don't give up, Doc. And thank you so much for answering these questions. And like the doc said, leave comments below, whatever you want us to talk about. We're going to keep doing this Doc Talk. So if you have ideas, suggestions, if you're watching this later, ask the questions. We try to get back and respond when we can. And if you have ideas for what you want us to talk about next time we do this, let us know. We're here for you guys. We're here for the community. So
it's my honor to talk to the community and be part of it medically. So please, anything I can do to help, you guys just let me know.
Doc, see you later, man. You be careful out there, all right?
Take care.
Bye, see you guys. Y'all be careful.